Good morning, everyone, and welcome to Viewpoint the Conversation, the Glaucoma special right here on Solid 100.9 FM. And you know that this discussion comes every Fridays from 9 a.m. to 10 a.m. And this has been a program where eyes have been opened, informations have been dished out, and everyone associated with Solid 100.9 FM can say for a fact that they are getting to understand and learn something vital. My name is Chibika James, and I'm not alone in the studio this morning. I have got Professor Nkiru Kizo Karaway, who is a consultant ophthalmologist, ISUT Teaching Hospital, Parkland, Enugu, and also representing the Governor Africa World Glaucoma Association. Good morning, ma'am, and good to have you on the program.
Good morning. Thank you very much.
All right.
Good morning to our listeners.
Very good. And it is a beautiful Friday morning, and they say that you don't know what can hurt you, or what you don't know. They say can go on to hurt you, but when it comes to glaucoma, what you don't know can blind you for life. Yes, now around the world, millions are silently losing their sight to the thief of vision. And in Nigeria, the story is no different. Yet, what makes it worse is not just the disease itself, but the dangerous false belief surrounding it. Beliefs that delays treatment, beliefs that mislead patients, and keep this silent killer hidden in plain sight. Some say it is it only happens to the elderly. That is what some people would say. Others believe that if you can see well right now, there is nothing to worry about. Some even think traditional remedies can cure it. But the truth, by the time most people notice glaucoma, it's already too late to reverse the damage. So this morning on Solid 100.9 FM, we set the record straight. And joining me, like I introduced, is Professor Inkira Kerwe, an expert in eye health. And she would help unpack these myths and give us the knowledge that could save our vision. And ma'am, it is very much accepted that knowledge, they say, is power, right?
Yeah, that's right.
All right, and so today we'll be equipping ourselves with knowledge so that we are not going to be ignorant, okay? Because they say what you don't know can't hurt you. So today we'll be trying to understand glaucoma. We would look at this dangerous myth. We will talk about the risk factors and reality check. We would also go further to talk about the consequences of delay, and we will talk about prevention and early detection. And yes, the message that our listeners can take home from this topic of this program today. But, ma'am, for clarity's sake, and I'm sure that we always, at every section of this program, have people who are listening for the very first time. So let's start with the basics, okay? What is glaucoma and why is it called the silent thief of sight?
Thank you very much. And good morning again, dear listeners. Thank you, Chibike. Glaucoma, which we've been talking about every Friday, it's called the silent thief of sight.
Mm,
Actually, what glaucoma is that it's a chronic damage. When you say something is chronic,
mm,
it doesn't happen overnight.
yeah.
It's a prolonged activity. So it's a chronic damage to the nerve for vision.
Mm,
And this damage happens over time, over years. However, it doesn't cause any symptom. And when we talk about symptom, we mean like something like redness, itching,
mm,
pain. Those are things that somebody will see or have, and want to see an eye doctor.
Okay.
So usually glaucoma doesn't cause any symptoms. So we say it is symptomless.
Hmm.
And so it is silent, and but it is there, and it is damaging the nerve for vision.
Hmm.
And over time it damages this nerve until it completely damages it. And so glaucoma is the commonest cause of irreversible blindness. Now, this damage it causes to the nerve is irreversible, and the so it's irreversible, and that's why it's become the commonest cause of irreversible vision. Now, some people will say there are different things that predispose somebody to having glaucoma,
Okay.
and which we call risk factors. In other words, if 1, 2, 3, 4 are in you, you're more likely to have glaucoma than any other person. So if you are from Black African, you're more likely to have. And if you come to Nigeria, it is worse among the Igbos. If you're Igbo, then if you are 40 years and above, so age, the older the person, the more likely to have. Okay, if you have a family history,
Hmm.
and then very importantly, which is even considered the main risk factor, is if you have raised eye pressure.
Okay.
Okay, so but something like having a raised eye pressure, you wouldn't know whether you have a raised eye pressure or not, except to check. But whether you're black, you know whether you're black, whether you're an African, you know whether you're Igbo, you know whether you're your age, you also know whether you have a family history. But a lot of people don't even know if they have a family history or not. You know, they say nobody has ever had it in my
My family.
family.
Yeah.
Now, it's one of the myths we would also address today.
All right. And talking about this meat, okay. There are some persons listening to us right now, and I would say, since when this program started, and we have been talking about glaucoma. Oh, I've gone to do my test, and they said that my eyes is in perfect order, and as long as I've done the test and my eyes is in perfect order, I don't need to worry about glaucoma again. So, in your practice, because you are a specialist, ma'am, and I'm sure that you have had cases with different persons, old, young, and all of that. What are these common false belief about glaucoma that you have experienced, and why do you think that people from this part of our world tend to believe all those kind of things?
Okay, thank you very much. So today we really want to address some of those myths think people believe that expose them to damage. I mean, if there's glaucoma in their eyes, that they don't get to find it out early. Now, remember we said that glaucoma is a silent thief of sight, and it damages the nerve for vision. Now, let me just put it a little word there. The nerve for vision connects the image that somebody is looking at, or connects the lights coming from an object to the brain for the brain to interpret it and say, oh, this is Chibwike, oh, this is Emeka, oh, this is Ngozi, you know, oh, that's a red car, you know. So those rays of light are taken by the nerve for vision to the brain for interpretation. So glaucoma damages that nerve for that, does that transmission, and so the eyes are, so to speak, looking at the object, but they are seeing nothing because there is no relay. Okay, like somebody cutting the wire that leads from a switch to the light bulb.
Yeah.
So though there's current, yet the bulb doesn't come on.
Yeah.
You know, so that's what's how it causes blindness. Okay, and like we said, it does that slowly and silently, painlessly. So the person having it will not know. So some of the things people believe that predispose them from getting blind from glaucoma, one of them is that they say, if I had glaucoma, then I will know now. And how will you know when the thing is silent? Usually, sincerely,
They have
glaucoma,
spiritual
as you are listening to me now, you might have it and you don't know. You don't know until it is too late in the disease process. So the time that it begins to give symptoms is at the advanced stages of the disease. And remember that we said that whatever damage that occurs, doesn't it's not reversed except by God. So it's irreversible. So you don't want to get to that advanced stage if you can avoid it. The vision is not something you want to toy with. It's not something you
Yeah.
want to play with. So you don't know that you have glaucoma unless you have checked.
All right.
So it's important to know that you need to check to know. And following the question you asked, somebody says, I have checked and I don't have, so I'm okay.
Yeah.
So that is another myth. Oh, I checked my eyes some 5 years ago and they said everything was okay, so I don't have any problem, and that's it. Now it doesn't follow. If you check this year and you don't have, it doesn't mean you won't develop it next year.
Oh, so you're saying that this check has to be yearly?
We advise it yearly so people don't forget. If you
Oh.
are like 40 to 50, one could say you can 30 to 50, you can do it every 2 years, but that people will forget. So we say do it every year. It's safe. You lose nothing. If it starts, it's picked early.
Now, this 40 to 50 that you said, many will also say, people listening to us, once we come on air, they will say, they're talking about glaucoma. Glaucoma now old people sickness, Jare. I'm still a young boy. I never enjoy life. How can they think about this kind of thing? Does glaucoma happen to younger people as well?
Exactly. Thank you. That's one of the myths. People like what you just said, glaucoma and old people matter.
Mm.
But it's not so. Glaucoma can happen to babies.
Babies.
Babies are born with glaucoma.
Wow.
There's a patient we had. At the time she became a patient, she was a university undergraduate. She's a special student, so, but she said that this thing was discovered when she was young, and the doctors told her parents that she needs to have surgery done, and the parents said never. And that how can such things can't affect children. We've had this. That's just, there are so many children. There are some 7 8 year old, 5 years, 3 years, 2 years we have operated on because of glaucoma. Because when you see glaucoma in children, the thing to do is surgery straight away. You don't
Okay.
start playing around. So it affects every age. Like I said, some babies are even born with it. But we are now talking about where it is more common. So we have seen 30-year-olds blind completely, 2 eyes, with glaucoma. I've once had a 30-year-old young man come into the clinic with the girl he wants to marry. And he tells me that, please, doctor, whatever you can do so that I can see and be able to move around, please do it.
Wow.
Whatever. And we examine him, and it is end stage glaucoma. He said that people are laughing at the girl, you want to marry a blind man. He said, but he's not blind. He cannot be blind. He can't afford to be blind. But unfortunately, he was blind. And that's the painful thing. So it's not a respecter of age. It's just more common as people get older. For instance, an 80-year-old is 5 times at greater risk of having glaucoma than a 40-year-old. Okay, so the older one gets, the higher the risk of having glaucoma. But it can affect anybody at any age. And then if somebody has had glaucoma, the child is at greater risk of having it like 10 to 15 years earlier than when he had it. So it's so important that at whatever age, especially in this part of the country, in this part of the world rather, and then actually in this part of the country also, so it's so important to check. It doesn't cost, and there are free eye checks that ophthalmologists around the country get to do when we have World Glaucoma Sight, World Sight Day. You know, there are hospitals that always offer free services. So if you don't have money, and this happens March and October, if you listen to the radio, you will hear when it's being done. So you can assess it. You can say, oh, every March I will have my eyes checked free of charge, because we are doing that as our corporate social responsibility
Yeah.
all around the countries. The ophthalmologists are committed to it. You know, so assess those care if you can afford it. But if you can afford it, then go into a clinic, pay, and have your eyes checked. You know, it doesn't cost that
All
much.
right, since we're talking about this part of the world, okay, and I'm sure you will agree with me that most of us are traditionalists, okay, and we believe that getting things from the floor, from the ground, can cure all problems because we all come from there and we all end up there. Uh, what are the consequences of one delaying in checking and knowing their glaucoma status? How much damage can be done before symptoms are even exposed? And what happens if someone relies on a traditional remedy instead of medical treatment? Traditional remedies, can it solve this?
Thank you very much. I know that there's a lot of medicinal properties
Mm,
in plants, in vegetables, in fruits. There are really a lot of medicinal properties. It's just that many of them are not scientifically quantified. So you can't say if you take this quantity, then this happens.
mm,
If you take below, then that happens. Now, there's no problem if you believe that some vegetables and some fruits will cure your glaucoma.
mm,
Get the scientific proof that glaucoma is there. If you have the leisure of time, you can try your vegetables and fruits and then go and check again and see whether, assuming your pressures were like say 30 and they were meant to come down to 12. Eh, So you try it, then see if the pressures have come down to 12. If the vegetables brought it down to 12, all well and good.
mm,
But to take vegetables, say it must be bringing it down, and you
mm,
don't check again to be sure it's bringing it down, then that is foolishness. Because the time you will now get to check, then you might have lost one eye.
mm.
You know, so it's so important that we don't deceive ourselves and get blind in the process. You know, by the time glaucoma will start giving somebody sign that is there, about 90% of the person's nerve has been damaged. And because two eyes also often function, you know, so people don't notice that one eye has stopped seeing. So many times it is the second eye we are talking about, the better eye. When that better eye stops, has damage has reached like 90% and above, that the person will now know I'm having some blurring. It's as though there is some harmattan. And sincerely, when you lose your vision, is another world. You enter another world, and you have to learn that other world, how to live and survive in it. And it's not an easy thing to do as an adult. So whatsoever you can do to prevent that, you want to do that.
I'm glad you talk about prevention. There are some persons because I tried as much as possible to be very practical and put myself in people's shoes. All right, now things are very difficult in our country, Nigeria, and with the way this word sound glaucoma, people they think say na big grammar, and big grammar sickness comes with big money to treat it. What are the simple steps, okay, that people can take to protect themselves and their loved ones from glaucoma? And from your expert opinion, ma'am, how often should one get tested? Probably for someone who is, let's say, 1 to 30, 30 to 50, and 50 to 80 and thereabout. How often can people from this age bracket get tested?
We want to say if you are young, if you are 10 years and above, 10 to 15 years, you can do once in 5 years. If you're up to 20 years, do one in 2 years. If you're 25, 30 and above, please do once a year.
Hmm.
If you've had trauma, if anything has hit your eye before, do every year. Do every year, do every 6 months actually. If it was a heavy trauma, do once in 6 months. Because sometimes some people get hit with a tennis ball, get hit with a fist or a
Yeah.
football. They go to the hospital at the time, treatment is given, and they think everything is gone and okay. But some damage has happened and they wouldn't know. And they develop what we call a secondary glaucoma.
Hmm.
Okay, so don't say that I don't no, the time I had problem, something hit my eye, or that I went to hospital, they treated it and everything went. That's so that I don't have any problem again. No, we have seen many who come back many years after and then they lose that eye because of secondary glaucoma.
Hmm.
Okay, and it's so important to note that when it comes to glaucoma, there's not much you can do to prevent glaucoma, especially the primary glaucoma,
Hmm.
because it starts de novo, it starts on its own. It's the secondary causes of glaucoma that you can do something to prevent. So you can wear something so something doesn't hit your eye. You can, if you have any eye problem, you see the doctor and be treated, and then you stop the treatment as at when due.
Hmm.
You don't continue using certain drops like steroids for a very long time that could give secondary glaucoma. Okay, so those are things you can do to prevent secondary glaucoma. But for primary glaucoma, the only thing you can do is to go for checks. And like we said, country is hard, but there are opportunities for free screening. Okay, so if you don't have money and you know free something is available, why
Make
won't
yourself
you? Then
available.
you say you are busy.
Hmm.
You are busy at the time. If you're busy, then that business should be able to bring some money that we pay for eye check later.
Yeah.
So otherwise, access the free care and get your eyes checked. They are actually your eyes and nobody else's. And if anything happens to them,
Hmm.
you
You
will
have
be the
yourself to
first
blame.
person who will suffer from it.
Hmm.
Now, there's some people have gone for checks. Maybe they enter and check their eyes and they say their eye pressure. Remember, I mentioned when talking about the risk factors that eye raised eye pressure
Hmm.
is a major risk factor.
True.
So some people enter some clinics and just check their eye pressure, and if their eye pressure is okay, they say, so my I don't have glaucoma. So, and that's a myth that only people who have high eye pressure get glaucoma. So but it is not so. There's something we call normal tension glaucoma. In other words, normal pressure glaucoma. The eye has what we call normal pressure,
Hmm.
eye pressure, the way we have blood pressure.
Yeah.
So there is pressure in the eye too, and that pressure has a range of 10 to 21. Okay?
Yeah.
So if it's within that range, we say it's normal. But there are people who that's normal is high for their eye. So though high, what I mean is that is normal, but they are having damage to their nerve.
Hmm.
Okay, so they're having glaucoma, though the pressure is within the normal range. And so we call those ones normal pressure glaucoma. So you can have normal pressure and have glaucoma.
Hmm.
Okay, and in fact, the study done in Nigeria, the National Blindness and Visual Impairment Survey done many years ago, the Southeast had very tended to have low pressures. Okay, an average of 22. Now normal is 10 to 21. The Southeast had a normal of 22.
Is it
I
because
mean,
of the food we eat?
not normal of 22. That's those with glaucoma
Hmm.
had 22. The nation had an average of 26 for those who had glaucoma.
Hmm.
Southeast for those who had glaucoma was 22. 22 is almost like 21.
Yeah.
So you can have all I'm saying is that you can have normal pressures and have glaucoma.
Hmm.
So the fact that it is it is normal does not mean that you don't have glaucoma. So how do you know that you have glaucoma? Those nerves, eye nerves, must be examined. Okay,
Hmm.
so it's not just enough to check the pressure. The nerves must be examined by the doctor to make sure that there's glaucoma or there's no glaucoma. There's any damage or no damage. And there's a characteristic way glaucoma causes the damage, because there are many other things that damage the nerve. So the way it damages it is characteristic. So if it is it, then that will be picked up as glaucoma.
Right, definitely that will be picked up as glaucoma. If you're just joining or if you have been listening, it is still the viewpoint, the conversation on Solid 100.9 FM, the glaucoma special. And this morning we are talking about the silent thief of vision, which is glaucoma. And we are talking about what you don't know and how it can hurt you. My name is still remains Chibika James, and with me in the studio is Professor Nkiru Kizo Akerewe, a consultant optometrologist, Isut Teaching Hospital, Park Lane, Enugu State, and she is Governor representing Africa World Glaucoma Association. Now, this is a partnership between Solid 100.9 FM and the Eye Specialist Hospital, TESH. And for those of you wondering where TESH is, it is located at number 11 Church View, Ekulu West, GRA, Enugu, Nigeria. Number 11 Church View, Ekulu West, GRA, Enugu, Nigeria. Mom, let's track back a little bit and let's get to exhaust this dangerous myth. Um, let's try to narrow all of this myth as regards glaucoma to the southeast. And if there's something I know about the southeast is that we sometimes are very superstitious. Okay, so what are these myths that you have encountered in your line of work as to why glaucoma exists and why we persistently believe in these myths?
Okay, so for instance, somebody believes that there's no such thing in my family,
Mm,
and so I can't have it.
okay.
And nobody has ever been blind in my family, so it can't happen to me. I will not be the exception, and so I don't need to go and check. Now that's a myth, because that nobody has had it. You don't know.
Mm,
You would rather say it hasn't been picked up in
yet.
anybody.
Mm,
Because somebody can have it and is not yet blind from it, and the person dies. How
mm,
do you know they didn't have it before they died? Are
mm.
you with me?
Yeah.
So that is but somebody someday gets to have it in a family. And what if it is you? There was a young lady, for instance, we examined sometime, and we told her the features she had were suggestive of early glaucoma.
Mm,
We asked her for family history. She said never. Nobody in her whole family had it. Say, well, this is what you have, and we think we should commence treatment. And she wasn't happy to do that. But we
mm,
showed her, did her tests and showed her the evidence. So she agreed and commenced treatment. Then after some time, she brought her mother for something else. And because the mother was having some itching, something. And when we examined her, the mother had glaucoma.
Wow.
that was moderately advanced. So, but the glaucoma, the mom's glaucoma the stage of her glaucoma had not reached the advanced stage that gives symptoms.
Mm.
Okay, so the mother was still seeing, but her glaucoma was moderately advanced. So this girl is here. It's when we say, see, your mother has glaucoma. She said, eh? Because but before then she said nobody has it in
In the
my family.
family.
So that grandfather you didn't meet,
Hmm.
that might have had it. How
Hmm.
do you know? Say,
Hmm.
my mother saw till she was 110. Thank God. Do you know if she had it?
Hmm.
She could be, she still, that she was still seeing till she died. Great. But she could still have had glaucoma. One eye might have been gone, and
Hmm.
she herself is not even aware that she's seeing only with one eye.
Hmm.
So somebody says, is another myth, I can see well, so I don't have glaucoma.
Hmm.
Let me tell you, you can be seeing 6-6. 6-6 is like normal perfect vision, how
Yeah.
far you can see.
Hmm.
You can be seeing 6-6 and 90% of your nerves have been damaged.
Wow.
So that's the deception. So that you are seeing well does not mean you you do not have glaucoma.
Hmm.
Because by the time glaucoma starts touching how far you see, you've lost 90 to 95% of the nerves.
Hmm.
So don't wait till it gets there. So it is the time you are still seeing well that you should make sure you check to see that whether it is there or not. And this is so important because when we do free eye screenings, free glaucoma screenings, it is the people who have eye problems that come. It is
Hmm.
the people who have been diagnosed with glaucoma that we call. You say, what are you coming to do here now? You already know you have glaucoma. We are doing glaucoma screening to detect those
That
who
doesn't.
who don't know.
Yeah.
So then you will see them. Those who have glaucoma, they are brought by their daughters or sons, and those ones don't fill the form to be checked. They say it's mama that has problem, they brought her.
Hmm.
But the screening is to screen the normal, supposedly normal people and see if they have glaucoma. So when we are doing glaucoma screening, we are screening those who do not know they have glaucoma to see if they have glaucoma. Okay, so that is so important that you don't say that because I'm seeing well, then I don't have glaucoma, because that's a major thing that deceives many people, that they get to lose their vision to glaucoma.
All
And
right.
talking about this part of the country,
Hmm.
the Southeast are very industrious people, very hardworking and busy people, so they often don't have time. So say, no, nah, I'm very busy. I'm really very busy. I don't have time to come and wait for my eyes to be checked. Nothing is wrong with it. I can see very well, But the day, and unfortunately, glaucoma is worse in the Southeast. So, I
Hmm.
want to advise our people, in all your busyness, love yourself. Going to do a glaucoma check is love for oneself. Even the Holy Script says, love your neighbor as you love yourself.
Yeah.
You're running around, especially the southeastern man is running around to provide for his family. You love your family, fantastic. But love your neighbor as you love yourself.
Hmm.
If you lose those eyes, if you lose your vision, all that running around ends. It comes to an abrupt halt.
Hmm.
One very common thing I have seen among young men diagnosed with glaucoma is that maybe you see them and one eye is advanced, the other eye is early. You do surgery in the advanced eye and maybe do laser or put them on drops on the early eye. and say, don't stop coming for checkup. They say, no problem, no problem. After that, you don't see them again. They say, okay, Nife. Eh? There we are running around. We are very busy, madam. We are running a thing. We have to survive. By the time they come back, that good eye has become worse than the bad eye that had surgery. So we want to encourage you, and that is one major reason why this program comes up every day, every Friday, is to create awareness that there is a silent thief of sight that is lurking around in people's compound. Check to make sure it hasn't entered your compound.
Right now, let's open up the phone lines and take your calls. If you've got questions or opinions, or will I say remark as to other things we have talked about, feel free to ask. The numbers to call are 0704 550 2840, 0909 771 1009, and you can also call 0902 311 1009. Hello, good morning to you.
Good morning.
Yes, good morning.
I'm Chris. I'm coming from Philippines.
Chris, can you sit up and speak up?
Yes, please. Are you hearing me now?
Much better.
Okay. So I have this glaucoma, and my own is beyond reversal. My wife had the same thing. Her own is now middle age now. Not even she has experiencing the symptom now. How can this be remedied? How can her own now be remedied? I went to test. It's very costly. My own test alone, 40 something thousand naira. How can this be remedied? How can be remedied at this stage?
All right, thank you. Yeah, thank you very much. Just keep listening. Prof will answer your question. Hello, good morning.
Hello.
Good morning.
Hello, Shiva. Good morning.
Yes.
Good morning, Prof.
Good morning.
Okay, I'm calling from Abia State.
Welcome all
Mr.
the way.
Chijoke.
Welcome, Mr. Chijoke.
The problem we are having here is that we are living in a rural area where those facilities are not, handy. So we are finding it difficult to go for such check. From here to Umuahia is, very, very, expensive, and not everybody can afford it. And I don't know how much it can cost for one to go to, the city to check it. You take the, glaucoma stuff. So I don't know. The problem we're having is that we are in an area where those things are lacking.
All right. Thank you very much. But sometimes when I hear people talk about proximity to treatment, but if you want to go and find money, I found tell you that there's job in so and so place. You can find it. But Prof, you are more equipped for this. Give answers to the two questions.
All right, thank you very much, Mr. Chris, who said that he had glaucoma.
Yeah.
From what he said,
Advanced.
it's the advanced stage,
Yeah.
and the wife is also
Getting there.
Getting there. It's so important to save her before she gets there, because the two of you can't get blind.
Yeah.
That would be disastrous, and that also means that your children have double risk factors from both sides. So they need to start checking early, very early for that matter. Okay, so we have government hospitals, that are more affordable because the government subsidizes care. The government pays the doctors, pays the nurses, pays your other staff. So that helps, for cost of care to be more affordable. So don't stay in your house and get blind. We have Parkland, it's there. We have UNTH, so go and access care. And if you're not in Enugu, you're in any other state, there are government hospitals that are more affordable, that you can access care from. So don't stay in one place. And even if those are not near you, cry out. You have relatives, okay? You have relatives, cry out. Cry out and help comes. Okay, and then for the second who said Mr. Chijoke,
Yeah,
that's a rural,
proximity.
yeah, rural area. Yeah, it's so efforts are being made to see how at least diagnosis, ability to make diagnosis can reach the rural areas through what we call through technology. Okay, but those are plans in the pipeline.
Mm.
In the meantime, what can people in the rural communities do? We make requests to good meaning individuals to remember your people in the village who might not be able to afford care. We had one commissioner sometime who invited us to his village, and there were so many people there who had glaucoma. Now, to diagnose is one thing, to treat is another. So you might have people in your community, they could be philanthropists, they could be politicians, rather
Yeah.
than collect, five cups of rice from them. Tell them, we need medical people. Please bring medical people for us and provide not just for them to see us, but also to treat us. That is life more than 5 cups of rice that you eat it once and it will not make any difference in your life. So that's just what I would advise. Sometimes we have even reached out to some communities, and the chief we now think that there's something you're going to gain more than just giving out care, and they want you to settle them. And that is something that is so important to watch against. That those who stay in the place of authority should not block services
Yeah,
that are
very
being brought
important.
to their people free of charge.
All right. We just have to wrap things up because time really is not our friend, ma'am. Just give us that's your most important message to Nigerians and everyone listening to us about glaucoma. And if you could correct one false belief about glaucoma today, which one will it be and why? Let's wrap up with that.
Yeah. The one very important one myth that I would like to correct
Hmm.
is that I see well, so I don't have glaucoma.
Hmm.
If you can understand and believe that you can see well and have glaucoma that has moderately advanced, then you will go and check your eyes routinely to make sure that glaucoma is not there. So please don't let glaucoma blind you.
Hmm.
You have the power and the opportunity to ensure you keep seeing. You need your eyes to function, to do any and everything you are doing now. Your eyes are most important. Imagine if they are gone. Just close them for a minute and try to do that thing you're doing and see how easy it will be. So don't take that risk. Go and check your eyes every year. Check it and let your loved ones also check it. Thank you very much.
All right, thank you very much, ladies and gentlemen. This is the wrap on the program for today. It has been a very interesting conversation, and one that I'm sure that if you continue to adhere with everything being discussed here, your life would be transformed. This has been a partnership between Solid 100.9 FM and the Eye Specialist Hospital Tesh. And yes, for those wondering where Tesh is located at, it is at 11 Church View, Ekulu West, GRA, Enugu, Nigeria. And with me in the studio today has been Professor Nkirikiza Kerwe, consultant ophthalmologist, Isut Teaching Hospital, Park Lane, Enugu. She is also Governor representing Africa World Glaucoma Association. Ma'am, it's always a pleasure to be here with you and do this with you.
Thank you very
I
much.
don't know, is there like a phone number for someone to call if they want to reach out?
All right. Yes.
Because I'm sure there are some persons who would want to have this conversation off air and probably get one or two advices, okay, to get themselves well equipped. Well, if you want to reach out to Prof or know more from the eye specialist hospital, you call the number 0809 036 0000 0809 036 0000. One last time, 0809 036 0000. Alright, we'll come again, same time, same station, next week, Friday. Do have yourself a wonderful weekend, and please do not drink and drive. And if you are to drink, do not drive.